Hepatic portal circulation is going to be draining the digestive organs, the spleen and the pancreas, and then it's going to deliver this blood to the liver. In looking at a picture of this, we're going to have the arteries bringing in the highly oxygenated blood. It's going to go through the digestive organs, and so we see that here where we have the nutrients and the toxins that are being absorbed by the blood, and then it's going to take that onto the liver. The toxins and the nutrients are going to leave the blood and enter the liver cells, and then we have the blood return back to the veins, which then can take it back to the heart. So that's what we mean by hepatic portal circulation. Basically running it through the digestive organs and then through the liver, and then again it can circulate back to the heart. So here's just another look at it. We have the veins that are picking up the nutrients and also the toxins from the digestive organs. Specifically, we're seeing the small intestines and the stomach in this image, and then they're going to take that blood to the liver. The liver is going to receive basically the toxins and then also the nutrients, and then the blood is going to return to the inferior vena cava. Fetal circulation is going to take place through the placenta. All nutrients, excretory exchanges, gas exchanges, all of this is taking place through the placenta. If we talk a little bit about the physiology of circulation, arterial pulse is going to be this pressure wave that's created by the alternating expansion and then recoil of an artery. This is something that's going to occur with every beat of the left ventricle. And recall that the left ventricle is the ventricle that is basically pushing the blood out into the rest of the body, so out to deliver that highly oxygenated blood to the various tissues. When we're talking about arterial pulse, there's a number of locations around the body where you can really feel it. That's what's being shown here with the little pink dots. So these are pulse points. Usually we have 70 to 76 beats per minute on a healthy resting person. So that would be a typical arterial pulse. Blood pressure is going to be the pressure that blood exerts against the inner walls of the blood vessels. And this blood pressure is going to keep the blood circulating continuously between heartbeats. And we already said that high or close to the heart, we're going to have a higher pressure. And when we get further away from the heart, which is really what we're talking about in the veins, then we're going to have a lower pressure. If we talk about blood pressure measurements usually have two numbers. We have the upper number and we have the lower number. And this is because we have a systolic pressure, or a pressure at the peak of ventricular contraction. And then we also have diastolic pressure, which is going to be the pressure when the ventricles are relaxing. If we look at how the blood pressure measurement is actually taken, I'm sure you're familiar with this and you've had your blood pressure measured at some point. We have veins that are running down the arms. That's typically what we're actually measuring the blood pressure of when we put that cuff on the arm. And the person that's administering this or actually measuring the blood pressure is going to inflate the blood pressure cuff. So we're starting to squeeze the arm, and then when that pressure begins to reduce, the person that's doing this is going to be listening to some soft tapping sounds that occur. And so the first number that they record is going to be the pressure when they first begin to hear the soft tapping sounds. Now, as the pressure continues to reduce and release, those soft sounds are going to turn to louder sounds, and eventually there's not going to be any sounds. So at that point, the pressure is released enough that the blood can actually flow through just fine. And so that is recorded as the diastolic pressure. So what factors affect blood pressure? I'm sure you've heard of many factors that can affect blood pressure. Peripheral resistance is one of them. So the amount of friction that the blood is encountering as it flows through the blood vessels can certainly affect the pressure. Here are a number of things that can affect that. So we could have decreased blood volume. Exercise can have an impact. Changes in your posture. We could also have different chemicals, drugs, increases in blood viscosity. All of these are things that can ultimately alter the blood pressure that we have, and this might cause increases in arterial blood pressure. Here's a blood pressure chart just to show you what those numbers actually mean. We've got the systolic pressure on the y-axis, we've got the diastolic on the bottom. And as you know, when you get your blood pressure measured, you get two numbers that are handed to you. So this chart right here is kind of nice. It shows us exactly where we would fall, whether we are considered to have good blood pressure or whether it's too high and perhaps medication is necessary. Of course, whoever's taking your blood pressure is probably giving you that information as well. But you can see that even having a very low blood pressure is a problem, and very low blood pressures, they do require medication most of the time as well. Here's just another blood pressure chart just to show you what's classified as low blood pressure, normal blood pressure, kind of pre-hypertension, and then we also have stage 1 and stage 2 hypertension. The higher we are on this, the worse it is, and the more need for medication to control those blood pressure numbers. The capillaries, they function in the exchange of gases and nutrients at the tissue level. The substances are typically going to use one of 4 routes to either enter or leave the blood. We can have direct diffusion through the membrane, so diffusing right into the capillary. We can have diffusion through intercellular clefts. We can have diffusion through pores. We can also have transport via vesicles. So again, all of these are responsible for the exchange of gases, and this is really two-way flow between the capillaries and then also those tissues that they're serving. Now here's just a closer look at it. We can see that the blood is moving through the capillary. It's moving through the capillary bed, and it is leaving the capillaries, and when it leaves the capillaries, we can get the oxygen and various nutrients entering the tissues, and then the high carbon dioxide concentrations, the waste, whatever is going to exit the tissues, and then it's going to go back into the capillaries, so enter the bloodstream again, so that we can get that blood out through the vein system. If we finish this up with just a few key points about the developmental aspects of the cardiovascular system. Heart development begins very early in the embryo. And by very early, typically the heart is beating and pulsing by week 4. And so here we can see that at day 15, we can already see structures of the heart. You can see the ventricles and the atriums kind of shown there with the V's and the A's. And then by day 21, so 3 weeks in, we've got more of a tube-like structure. But by day 28, so 4 weeks, we've got enough there that we do have beating and we have pulsing. And when you look at it at day 50, we have a pretty substantial looking heart when we're looking at the heart inside of an embryo or inside of a fetus at that point. So heart is developed very, very early during the whole embryo development process.